Smart bands, smart watches. How do they impact healthcare? Can they be used for healthcare? That's what today's talk is all about, so let's go. One of the most important things in life is health. You can't buy health, and technology can help a lot in maintaining your health and acknowledging if you have problems or not. A few years back, the whole fitness tracking, smart bands stuff started, and I got my jawbone as well. And basically then nobody had such a thing. And I was one of the early adopters. A lot of people ask, what how does that make sense? What do you use them for? How can they keep your health up? The first generation of bands, as you might know, only tracked your movement. So like this jawbone, that only tracks movement, and I have set it up so it vibrates when I don't move for some time. Stuff like this helps you figure out if you're sitting too much, if you don't move enough, and if you're too passive. And so when that thing vibrates, I get up and, for instance, work standing. That got me thinking some time ago, how is technology going to influence the whole healthcare sector? Because nowadays the watches, the bands, they have heart rate sensors and maybe in the future even more sensors to track how your body is reacting. I think this can be a real big trend. Personalized medicine, where you collect your own data and you upload that data, or that data gets automatically uploaded to a platform, and the platform is predicting how is your health, how is your health going to be in the next days, do you have some serious problems. I think this is something that will come, and the sensors will help a lot. So this thing only had motion sensors. The new ones like that Moto 360, they have heart rate sensors, and I think in the future what we're going to see are more chemical sensors that detect on your skin how your metabolism is working and so on, that when a problem comes you are going to get notified that in the future, in the next days, this and that might be a problem. It's nothing crazy. A colleague of mine, for instance, he has a insulin pump, and that insulin pump measures his levels, and when the levels drop, he gets insulin from the pump, and so he stays on a good level. The pump is connected to your app, so you can monitor your health or the levels on the app. You already see some projects that are working with medical care. For instance, IBM's Watson. There's a big Watson campaign where Watson is analyzing tumor data. So the system classifies, is this probe okay or is this not good? And this will be a big market when you think about insurance companies. Right now, health insurance, you have fixed rates and you pay, or you have a rating model and you pay according to your rate that has a lot of variables. This can change drastically, especially for the insurer. So the insurer can calculate the risk a lot better on how risky is it to insure someone, how high should he be insured, what should be his rate for the insurance based on the health data. I know it's a bit scary because if you have bad health then you pay a lot, and but this will come. On the other side, everyone who is fit and uses the models then gets a cheaper price. And when this gets integrated with the doctors, then you don't have a chance of saying, no, I don't want this, because the doctor gets your health data and can check your health data and can get predictions and he can help you a lot better than he used to. One futuristic thing to think about is the bands and the watches are only the first step. The next step would be to measure stuff through contact lenses, because you have direct access to fluids. This might sound a lot sci-fi. Can happen. I also recommend, if you use such a tool like a Jawbone, a Fitbit, go to their website and download your data. You usually can download all the data that gets sent from you to the provider, like the tracking, your heart rates, your sleep cycles, and so on, and hack your data. Find out what you can learn through your data from yourself. When you think about hospitals, if every patient has a smart band on his wrist, the hospital knows exactly what is happening to each patient and can react as quickly as possible to every problem that occurs. This will not only help intensive care patients, this will help basically every patient in the hospital. Jawbone, the manufacturer of those bands, they move away from traditional end consumer to hospitals. They are doing exactly that. They are going to hospitals, they are trying to fit the bands or sell the bands to hospitals, so every patient gets such a band. When the team gets those things as well, you can optimize how they interact, what they are doing, how they interact with the patients, and so on and so on. So it's also some kind of asset optimization when you see the employee as an asset, and companies surely do. I recently looked into the Samsung S3 Frontier smartwatch, and that smartwatch already has a system in place where if you have a problem, the watch automatically sends a message to some contacts you specified. You have the watch, you press a button, and then the smartwatch sends out a message to some of your contacts, so they know that something is wrong with you. Someone can call in. So you have a problem, the watch notifies your emergency contact, the emergency contact calls you, and you can talk to him just with the watch. And now the next step would be that call gets automatically sent because of your health data. So for the elderly, this would be a really good system. They have the watch. If something is, if there's a problem, the watch calls and done. Or the watch automatically calls emergency 911. How this can work is with anomaly detection. Because you wear the watch all the time, the system learns what is normal from you and from all the other guys who are wearing those watches, and then so that when some variables diverge, it's an anomaly, then the system automatically calls the emergency contacts. And if you wear something like this, it gets cheaper for your health insurance, for instance. So I think this will be a big market. This will be a big market in the future. It would really interest me if you know some use cases where this actually is done already. Post me a link in the comment section and let's have a discussion.